I think it's important first that we understand what we mean by supportive care and optimal supportive care. Supportive care as a title, as a concept, has been around for many, many years, but I don't think that oncologists really got it until quite recently. For a long time, I think oncologists thought supportive care was another name for palliative care being another name for end-of-life care. And to some extent there is an overlap, but I think what's very important to understand is that supportive care is at all stages of cancer. It starts the day that someone gets a diagnosis of cancer. It follows them through the cancer treatment, particularly helping patients get through the cancer treatment. It follows them into advanced disease and end-of-life care if that's appropriate. Then it becomes palliative care. And it also now follows people into long-term survivorship, which in many cancer types, can go on for many, many years, as you know. The thing about BTOG, British Thoracic Oncology Group, is that it's one of the first oncology organisations to understand the role of supportive care. And I think that's something about the nature of lung oncologists and chest physicians and respiratory nurses, that they have a much more holistic approach than many other areas of oncology that I've worked with. Not to say that other oncologists are not interested in supportive care, but in lung cancer, because from the very, very early days of lung cancer research, we were facing a disease which had enormous symptom burden for patients, and the treatments were also very heavy. So one of the important things about supportive care is that it helps the patient to cope not just with the problems that the disease brings, the symptoms, the progressive fatigue, and then for many patients, the end of life. It also now increasingly helps them to cope with the side effects of the treatments.